Hi, I thought of doing a clinical for you, and this is especially for speech therapy students who have been at home for a long time, and for you all to learn what we know. And this is the topic actually the voice disorders, and one of my favorite. So I thought of just talking to you all today. When considering the voice disorders, we get in hospitals as well as in outside in private sector, wherever. If there's a problem with voice, you will hear the difference of the voices, and different voices you have to hear to your ear, and then only you have to diagnose. So in the diagnosis process, the case is to take in and clinical examination, and especially with this of COVID, and you have to be very careful like this, okay, and with all mask and gloves and all, right? And all this, also the distance, you have to maintain the distance of the patient. Now those are especially added in 2020 when COVID protection clinicals, right? Okay, so I would like to tell now, when talk about the voice disorders, commonly we get in clinicals, in clinics we get mostly the hoarse voice. It's a general word. The hoarse voice goes with the vocal cord nodules, and then maybe the vocal cord palsy, and then polyps, and then the edemations, and so on. If it's chronic, we can be suspicious about the sulcus vocalis, hope you know, or sulcus, maybe globus pharynx, we feel a pain, not exactly a pain. And with that, and psychogenic voice disorders. Okay, so evidence-based practice we usually continue in clinics with the cases to take in and the bedside or the clinical assessment. Perceptual, there is observable or acoustical. Now there are when we remind again about the assessments, we have perceptual, observable, and acoustic types of assessments. So observable assessment, usually we can observe through a foil or stroboscopy or any other way. And the perceptual is that's observable, right? Perceptual analysis is what we hear to our ear. A speech pathologist, a voice specialist, or the speech therapist, all the same, right? So all hear to ear the voice quality, and then only we diagnose. In the criteria, we measure the quality of the voice, and then the intonations and the respiration patterns and the local stamina and so on. According to that, we mark where the patient is in, and then according to the details which we get from the patient, we do the diagnosis. I will show in future, if possible, the cases, if with the patient's consent, for you all to learn. Different types of voice disorders, especially we'll say about 60% we get the hoarse voice. Hoarse voice we usually don't use as speech pathos. We use the vocal abuse. Vocal abuse may be due to those conditions which I told you, and whoever use voice a lot or not suitable using of voice brings the problem. So diagnosis can be done, maybe it's functional, behavioral, or anything else of dysphonia with the low or pitches, the level of the pitch, high pitch, low pitch, or mix in the middle. And due to that is the diagnosis writing pattern which you have to maintain, and which I have been using for 20 years. And I really want you all to do it, right? I usually, when students turn up, we usually show the cases reforms which we fill, and then you have to learn those types. And the writing is very important of a clinician. The way you write, the way you express for the other staff to know the details and your ongoing practices with the patient, right? Okay, Now I will be in detail, we'll be talking about the voice disorder. This is just a summary. And then voice disorders we get in OPD section or as outpatient, as well as in the clinical bedside evaluations also. That's mean ward patients also. Whatever the thing happened to the vocal cord or the process may occur a voice disorder. Okay, so the voice disorder may be a developmental as well as acquired. Developmental disorders, one is puberphonia, which usually according to the age the voice may have not changed in male, so that's called puberphonia. I'll teach you that later. And it's a psychogenic, right? It's totally psychogenic, and in National Hospital clinic all have got better with puberphonia. We have research findings, yes, and if you come you can see we have case histories also with the numbers and all registered. Okay, so that's psychogenic. And post-traumatic stress disorders also bring psychogenic voice disorders. Apart from that, the behavioral behaved and bring the vocal cord nodules or the intimation and stuff, right? And then functional, the process also brings the voice disorder. So we'll talk details in future. Good luck. Think about that and start reading about voice disorders. All the best.